My name is Mary White, and today I'm introducing Betsy Hopkins. Thank you, Betsy, for being here today.
Yeah, thank you, Mary. So like Mary said, my name's Betsy Hopson, and I'm the director of the STEP program, which is a collaborative program here at Children's of Alabama and at UAB. So I'm really excited to talk to you about that. Mary and I know each other well because Mary's a patient of ours at the STEP program.
Yes, I am 24, so I've been there 24 years at Children's. Basically, I had 44 brain surgery total in my life. I have a shunt and I do my daily things. And now I work at Children's. I'm an employee. I never knew it was possible, but it is. But now I'm transitioning to Children to UAB, which is what Betsy is the director of the STEP program, and she's very helpful with that. And yeah, she's going to tell us more information about that. So Betsy, what is the STEP clinic all about?
Yeah, well, thank you for asking. We keep saying STEP clinic and haven't really defined it, but STEP stands for Staging Transition for Every Patient. And so we are a program that's a collaborative program between Children's and UAB that's designed to help children that have any childhood medical complexity transition from pediatric care to adult care.
So who can use the STEP program?
Well, after doing the clinic for about 5 years, we've kind of figured out the patients that we feel like we're best able to help. And so there's several categories or types of patients that are best served through the STEP clinic. So one of those groups are patients with autism or intellectual disability. Another group are patients that have 2 or more organs involved, and you can usually tell that by how many specialists they have here at Children's. So for people that have 2 to 3 specialists here at Children's, those are patients that we do a really good job serving. And then patients who have any technology dependence, so patients with a shunt or on the home vent program, patients like that, we can really help.
Okay, that's so cool. 2 words I need to understand: transfer of care and transition of care. What do those 2 words mean?
Yeah, well, I'm so glad you asked me that because I think the difference between those 2 words is really important. When we think about transition, we're really thinking about that whole process of getting someone ready for that eventual transfer that's going to happen. So when we think about transfer of care, we're talking about that one-time point. Like I was a patient at Children's of Alabama and now I'm a patient at UAB. So that's that one transfer of care. But transition really involves the whole process of getting ready for that, and it should really start very early. What we've learned at the STEP clinic is that the people who have the best transfer are people who've had really good transition planning. We think that should start very early, by the time someone's 13 or 14 years old in early adolescence, that they should begin assuming more and more of their health care in that plan for independence. I even say that transition planning can start with babies when they go from their mom holding their bottle to them holding their own bottle, or from their mom tying their shoe to them learning how to put their own shoes on. Transition is a continual process that starts really early.
I know after being a patient at Children's for all my life, going to UAB can be a scary place. How does the STEP program help me with my fear of transitioning to UAB?
I'm so glad you mentioned that because one of my big mottos at STEP Clinic is that it's okay for transition to be sad because you're leaving a whole team of doctors at Children's Hospital that have become like family to you. Yes. And they've been with you through your scariest moments all the time you were growing up. And so it's totally okay for transition to be sad, but transition shouldn't be scary. And so if we at STEP Clinic are doing our job of making sure that there's no interruption in your care and that we have all your specialists in place, then we can say, Mary, you're going to get the same great care at UAB, and hopefully we can make that less scary, but it's okay for it to be sad. We just don't want it to be scary.
Is there anything else you want to tell us today?
Yeah, I mean, I think in line with kind of what I just said, that what I want pediatric providers to know and also parents and individuals to know is that it's never too early to start those discussions and to start understanding transition. What patients tell us over at the STEP clinic is that they really wish that their pediatric doctors had talked to them about things earlier, things like guardianship and Medicaid waiver. Many of those things have waiting lists, and so if people get on those lists earlier, it can make the transition a lot more smooth. We actually have a conference every year in the spring, so this upcoming one will be on March 7th, 2025. We do it in collaboration with United Ability, but the STEP Clinic brings in speakers from across the state to talk about many of these things, and we invite families and physicians and nurses to come to this event where we can begin the discussion of what are these things that parents need in order to prepare for transition.
Hey, Betsy, tell me more.
Yeah, so some of the things that we want families to know about, this past year in Alabama, there was an act that passed. It was House Bill 55, which is called the Colby Act. And what that really means is that a bill passed to help patients that is related to supported decision making. And so it's an alternative to guardianship. Before supported decision making, someone who had complex medical conditions really only had the choice to either be completely independent in their decision making or go full guardianship. But now we have this law that's for supported decision making, and it's where a patient like you who's being seen at the STEP clinic could say, hey, you know what, I want to have a parent or a guardian or a supporter help me make healthcare decisions, and you can identify who that person is, and then we at UAB can put in the health record who that person is, and legally what it means is that we always have to allow you to have that person at bedside with you. So it's really important that those documents get in place. You can imagine during COVID when there were restrictions about which parents could or who could come into the room with a patient, it could be scary because you might want to always have someone at the bedside with you, but this bill allows you to be able to identify a supported decision maker who can help you with making all of your healthcare decisions. And we really want families to know about this much before they turn 19 or before they become an adult. We want them when they're 15, 16, 17 years old to be thinking about which path is the right path for them. Is it right for them to stay on an independent decision-making path, a supported decision-making path, or full guardianship? So those are some of the things that we want people thinking about during that transition process as they're getting ready for the eventual transfer of care.
Where can you go for more information?
Yeah, thank you. So you can look on the UAB website at UAB/STEP program, and there's a referral page there. People can even self-refer, but that's also where providers can go to refer a patient to the STEP clinic. And then here on the Children's of Alabama website under STEP program, we have lots of transition resources for families who are beginning to think about transition and some of those things that we talked about. All of that's on the Children's of Alabama website as well.
Okay. Well, thank you so much.
Yeah, thank you.